Hi, my name is Melanie Weller, and I want to talk to you again about vagus nerve health and vagus nerve decompression, particularly with respect to mental health. And this has been an issue near and dear to my heart. And I believe part of the reason that I have ended up studying this and really and further developing some of these concepts is because it's helped to also to heal myself. Your vagus nerve, just to recap, is your largest peripheral nerve. It starts in your brainstem at the base of your skull. It goes to your throat, your heart, your digestive system. It mediates sweating, it mediates inflammation, it even mediates orgasm. So it has a really, really far-reaching effects. One of the most So when I've seen clients in my office, my background is a physical therapist, I kind of do this head-to-toe assessment. If you hear a little bit of noise in the background, my dog is very enthusiastically playing with his toys this morning. Anyway, I do this head-to-toe assessment, and some people, when they're really basically stuck head-to-toe, I call that vagus nerve lockdown. To me, they're compressed at the base of their skull, they're compressed through their chest, they're compressed at their diaphragm, they're compressed through the abdomen and pelvis, and there's just no movement. All the normal motilities that should be there are gone. And one of the interesting correlations I've made with this is that some of those people that are in full vagus lockdown are having suicidal thoughts, they're planning suicide, or they feel like they're dying on the inside. And so that correlation with either feeling like you're dying or wanting to die in vagus nerve lockdown is really interesting to me. On my YouTube channel, there's a video called John's Story. I'll post a link in the description, but John is one of those people that was planning to kill himself if his visit with me did not end up helping him, and it helped him tremendously, and that was just super, super exciting. I would love to see more people to get a bigger reference for how this really works in the in a greater number of people, but it's really getting your system moving. All of our organs move. Like, we move on the very smallest levels. Our atoms move, our electrons move, and when your body ends up really getting into this lockdown, it's almost like you are dead, or there's such an element of stillness there that within the physical system, and getting that re-energized and recharged is really helpful. And the other piece of it is that it's really about bringing, for those of you that are practitioners, and I'm sure a lot of you already know this, it's about bringing all of yourself to the table. As a physical therapist coming out of the medical system, there's very much this stay in your lane and in your practice act thing that we all have to do. And particularly when you're in a hospital system or a more conventional medical establishment. But part of what I'm really doing, because I have found that staying in that box doesn't serve me, and it doesn't serve my clients. And so, for example, with John, I gave him a very good psychic reading. I gave him a really good mediumship reading, and did that all at the same time that I was doing all of my standard vagus nerve decompression stuff, and it all helped. We both agree that there was a greater effect because I brought all of myself to the table than if I had just said, oh, I'm just going to do the vagus nerve decompression. I'm not going to use my intuitive skills to help you. And so for me, coming out of that box is maybe it looks a little bit more like, not so much like stepping on into another medical practitioner's domain, but really kind of bringing the high priestess within me to the table to really, for maximal healing. But I've seen this a number of times. I've even had getting somebody out of vagus nerve lockdown get rid of about 90% of some terrible hallucinations that they were stuck in. And I've had it just help people that just felt like something was really wrong, like they were dying on the inside. Something was, and that's a very consistent phrase. I feel like I'm dying and I don't know what to do. And so by the end of April, I plan to launch an online course in in decompressing the vagus nerve and really getting that vitality back within your system. Sometimes we can't do this alone, and you need a practitioner that can also do this. And there are many osteopaths, some practitioners that have some training in cranial or craniosacral therapy, that also have integrative manual therapy is another great one, that have lots of great techniques for decompressing the vagus nerve. So this does exist in a few different domains, and I encourage you to ask your practitioners what you can do, and I will want to really bring this forward on a bigger scale to help a lot of mental health issues. And it's not just to the lockdown is very specific to the feelings of wanting to die. It also plays in very heavily to anxiety and depression. And I've treated many, many people with that as their primary diagnosis, and know that this is really, really helpful. And it doesn't necessarily replace everything else that you're doing. You still need your counselor, your psychiatrist, there's but it's a really, really powerful adjunct. It can really, decompressing your vagus nerve can really serve as a catalyst to getting you to a better place, and to a place where hopefully you need less medicine and less intervention, and you're surviving and thriving on your own. So I will be doing more videos about this, and if you have any questions or comments, please ask.